Welcome back to OneMDHealth, where science meets soul. And today's episode is about science and some soul as well. Today, we're talking about something that affects millions of people, but often gets dismissed as simply cosmetic for men and women: hair loss. That's right. For many women and men, changes in their hair can be one of the first signs that something deeper is happening in the body. What could it be? Could it be something that, maybe I just used the wrong shampoo, or I'm just stressed out in this following week? Or could there be something deeper going on? Could it be exactly like where maybe there's gut issues? Maybe there's a cancer-associated diagnosis that's happening. Maybe it's old age, maybe it's hormones. But the most important thing is, hair loss is a clue. It's not the diagnosis. It is a clue to what exactly is going on in your body. And I find that a lot of patients that come to me, they don't know where to start. And most of the times, that is the most common cause or symptom why they come to me. Hey, doc, I'm losing my hair, and I have no idea why that's happening. And I'm not sure how to address it, how to handle it. So my next guest is so interesting, and I'm so excited to introduce her. Her name is Brittany Morgan. Welcome, Brittany.
Hi. Hello, thank you.
So nice to meet you. And she is a trichologist who specializes in hair and scalp health. She helps people understand what their hair may be revealing about their overall wellness. So welcome, Brittany.
Thank you. Thanks for having me.
It's very excited to have you here. And I think really what I'd like to do is I kind of want you to just tell me a little bit about yourself and our viewers of what you do and what exactly is a trichologist and where you are located.
Yeah, so I am located in Winfield, Illinois.
Oh, great.
Yes, I'm located in Winfield, Illinois. So I own Genesis Center Hair Loss and Rejuvenation. So we specialize in scalp health, hair loss. We are not a mainstream salon. So really all we do is holistic wellness and hair loss.
I love it.
Yeah.
I absolutely love it. So what inspired you to get into this field of trichology?
Yeah, so I was a hairstylist for probably about 10 years in the mainstream market. And I wasn't really being fulfilled by that anymore. And then I had seen a job posting for a hair replacement specialist at a corporate, like a real big conglomerate corporate company. And I was like, all right, that's different. Like, let me try it out. And I ended up falling in love with it.
Yeah.
So I was doing wigs, toupees,
Okay.
and then their version of a hair loss treatment. And then when my daughter was about 2 years old, she lost about 90% of her hair.
Oh my.
From alopecia area.
I see.
Yeah.
Okay.
So that's the one with the round patches.
Yeah.
Yeah. So I did take her to a dermatologist at the time. And, I praise God for having some sort of knowledge that I already did from working at this hair loss company, because they wanted me to put her on 5% minoxidil.
Oh my.
It's formulated for men.
Okay.
And a steroid cream.
Oh wow. Okay.
And so it just didn't sit right with me. And I said, this is a 2-year-old baby girl.
Yeah.
She hasn't gone through puberty, and you want to load her up with all of these things that can affect hormones. So I said, absolutely not. So then that's what really got my gears turning to, there has to be a more natural way to treat this. So I did a deep dive into hair loss and holistic medicine, functional medicine.
I love it.
Yeah,
my kind of jam.
Yes.
I love it. Yes.
And I have been down the rabbit hole for about 7 years now.
I love it.
Keep going deeper.
I love it.
Yeah. So then about 2 years ago, I decided to, make the jump and become a trichologist. And
no looking back.
Yeah.
Here you are. Well, I find this to be so fascinating. So I love that story about your daughter. And the funny thing is that all of us definitely develop hair loss in our lifetime, whether it's hormones or whether it's a cancer diagnosis or a chronic disease, whatever it be. Like, I feel like hair loss is it's a clue. And what we don't understand is that it's so much more than cosmetic, right? We always think, are we just being vain? It's more than just cosmetics. It's more than, it's really a health concern.
Yeah.
It's a clue. It's a sign. So In trichology, tell me, what exactly do you study of the hair scalp, and how do you go about it? Like, when a patient comes or client comes into your salon, what do they have to undergo? Do they have to undergo any testing? Like, well, how does it work?
Yeah, so with trichology specifically, in the schooling, you are studying the body and the body systems, how they integrate and work together.
Okay.
And then we are trained as trichologists to look at the body as a whole because, like you said, hair loss is a symptom of something internal, whether it's an underlying condition, a chronic condition, hormones, whatever the case may be. So we are trained to find what that underlying cause is. And then I personally work with a functional physician.
Do you?
Yeah, I work with two separate ones. So then, because I'm not qualified to work internally, so I refer out for internal work, and then we work externally at the center.
Lovely.
So it really is a whole body.
I love it. I love it. Well, I'm very excited to work with you too, as one of the other functional medicine physicians as well, and like in this area, because I have so many patients that complain about that and hair loss. So let's talk about the different types of patients and clients that you do see. So what type of patients, clients do you see, like male, female, age group, what particularly come into your office?
Everyone.
Yeah.
Yeah. I wish I could say it was only male or only female. Unfortunately, I get some kids that come in with some stuff going on.
Kids, wow.
Yeah. So it really is all age groups, because with the way that our society is today and with the things that we're eating and that we're consuming and the products that we're using in our homes, really no one is immune to health issues anymore.
When you do the testing, is it like a hair sample, or how does it work?
Yeah, so we can do a whole bunch of different testing. So we can do a hair analysis, which can look for heavy metals and environmental toxins. And then we can also do a blood spot analysis for nutritional deficiencies.
Okay.
We can also do a stool analysis for like a whole body. We're looking for parasites, heavy metals, environmental, like all the
stool test.
Yes.
The famous stool test. That I tell all my patients about. Get the damn stool test. Yes. Okay. See, even trichologists recognize.
Nobody wants to do it, but it's so important.
Nobody wants to do it. It's crazy.
It tells so much.
It really does. Can we please elaborate on how important the stool test is? Because when I tell my patients that you need to do the stool test, they hesitate, a lot of them. They say, it's gross. Is it really necessary? What does my poop have anything to do with my health? Everything. Right? Right. And I love that you offer that for your patients too. And so when you get that stool test and you get the hair analysis and the blood, did you go over those results with them? Oh my God, that's amazing.
Yeah, so I'll go over those results with them. I can also have one of my functional physicians do that as well. They offer the same exact testing that I do. And then they can also bring in their blood work too. So I'll do like a quick overview of see if anything's looking funky. Again, I'm not medically trained, but I do have a background in, a little bit of functional. So I'll quickly go over their blood work, see if anything looks, out of place to me. And then if I'm like, okay, this doesn't seem right, then we'll refer to the functional. Either way, we're referring to functional no matter what, but they'll do a deeper dive.
I think it's so wonderful and amazing that you even have that knowledge of how important stool testing, nutrient deficiencies relate to overall hair loss, because a lot of times what I find is that everyone wants to purchase these special hair serums, and they're great. Don't get me wrong. There are a few of them that I really love and that I use myself, right? But it's not the whole picture. Like, it's really a whole body transformation that you have to do, because you have to look at gut health, because what is eating at your nutrition, right? Because if you have a parasite, you have a bacteria that does not belong in your gut microbiome, such as, let's talk about it, the most common bacteria I'm sure you see in your practice, H. pylori. It's everywhere. So I would say 80%.
I just had a client come in who had been struggling with what he thought was dandruff for 2 years, which immediately is a red flag for me, because dandruff is not a 2-year long process, or that you have for 2 years. Went to another trichologist, gave him all this stuff for dry scalp and dandruff. Turned out that it was fungal.
Oh my goodness.
Candida.
Candida's a big one.
And an H. pylori infection in the stomach.
So better than anybody
Yeah.
with, you know what that means. That means, first off, the candida is being replicated secondary to stress. So there's a little bit of candida in the stool no matter what. But when it's over amplified, that is a stress signal. And then candida recruits all their bacteria friends and they eat up your iron, which causes the hair loss, right? Yep. And they eat up your zinc. And they eat up all these nutrient deficiencies.
All of them.
It's fascinating to talk to somebody that understands what I'm talking about. And that it's overall more than just hair loss. Yeah. And so what they don't understand is that you have to move the needle with nutrients and get rid of the parasite and cut out the candida. And also, in a way, rebuild your gut lining. Yes. Right? Well, because of the H. pylori. Right. Because the H. pylori is eating at the gut lining. Yeah. So this is what's fascinating.
Yes. And then all those toxins are going back into your body and it's this vicious cycle.
And that's why these tests are more than just like, oh, it's just something to have. It's actually not a luxury. Yeah. It's about the whole picture. So tell me, so when you see men and women, right? Yes. And when you treat men and women, do you notice any particular findings just to men compared to women and vice versa?
I would say for sure women, they tend to go more on the side of stress and hormones.
Okay.
And nutritional deficiencies. With men, it's typically androgenetic alopecia, which is just that male and female pattern loss. And the reason for that, I believe, is because men typically wait longer to go see someone before they're like, okay, this is an issue.
Okay.
And I want to say that men typically don't have a
Oh, but you could put it either way. We're going to be real here. It's totally fine.
Women tend to be more in tune with their bodies than men are. So they more so come to they seek out help before men would. And if something's going wrong, we just tend to be a little bit more in tune.
Right. We definitely are, because we don't want it to continue. Now, let's talk about men for a little bit. So male pattern baldness. With treatment, have you seen men regrow their hair? Or, obviously, as you know, when they have male pattern baldness, it's pretty much all gone, especially in the scalp. There's no coming back to that, right? That's pretty much gone?
Yes. So once the follicle is dead, it's dead. There's nothing that I can do or anyone can do to bring that back. Then you would be looking at surgery, which we don't do that in center. So if you have active follicles, I can see results. I will see results if you have active follicles.
Okay.
Now that greatly depends on what you are doing at home and then what I'm doing in center. My treatments are designed to regrow hair, regenerate hair cells from beneath the surface, nourish the scalp. But there's also things that you have to do at home to maintain those results.
I see.
Right.
And what do you, and this is all what my viewers want to know. So what do you recommend that they can do to maintain those results?
So big thing is I always push nutrition, no matter the reason your hair is falling out or thinning. Nutrition is going to be number one. If our body is in a state of acidity all the time, it reduces our bioavailability and reduces our chance for absorbing nutrients or anything that we put into it. So nutrition is number one. I recommend the Mediterranean diet for everybody.
I love the Mediterranean diet. It's the best diet. It's the best diet. So let's talk about that. So why do we love the Mediterranean diet?
It's anti-inflammatory.
It is. You get your protein. Yeah. It's non-restrictive in a way, right? Yeah. You get your salads in and you can make amazing dressing with olive oil, lemon, fruits, vegetables. And also, it's non-restrictive in most blue zones, and I'm sure everybody knows what blue zones are. That's what they have, Mediterranean diet. And so I totally am in favor of that. Do you find a lot of patients that don't eat the Mediterranean diet? What do you find a lot of your clients eat?
Yeah, so the majority is the typical American diet.
Okay.
And it ranges. I've had clients come in who are doing the carnivore diet, so they're getting zero nutrients.
Okay.
I've had clients who come in who all they eat is fried food and junk food.
Okay.
So it really does vary. But the most important thing is like, are you willing to make that change?
Mhm.
Because if you're not willing to make the change, what I do in center is not always going to be, the results won't last.
Right. I mean, it's up to the patient, right? And
Yeah.
I think the first step that patients have to understand that it starts with you. And this is not just a quick fix of serums and even supplements, multivitamins, especially when I see patients in the office. It's a lifestyle change.
Yeah.
It is a lifestyle change. It's about you have to make nutrition your priority. Like your life depends on it because it does, doesn't it?
Yes.
I mean, so do you talk about protein with them,
Yes.
fruits? And I mean, so 30 to 35 grams of protein within each meal, and they have to eat breakfast, lunch, and dinner.
Mhm.
Do you find that most of your patients don't even eat breakfast?
Majority do not. Majority
You
do not.
have to.
Yes. Yeah. And we have a whole guide as well.
I love it.
It's like this, it's vitamins and mineral chart. So,
Really?
yes. It shows you all of the vitamins, all of the minerals, and where you can get them in food, as opposed to a synthetic supplement.
Oh my
Because
goodness.
our bodies are not designed to process synthetic material.
No.
So we're taking these vitamins, right?
Mm-hmm.
And say you're pulling out vitamin A from an apple,
Mm-hmm.
and you recreate that synthetically.
Mhm.
You stick it in a vitamin, and you
Mhm.
expect somebody's body to absorb it.
Right.
It's just not how it works.
Right.
Yeah.
Right. I mean, listen, even when I prescribe supplements and vitamins to my patients, I always tell them the best way is getting it out of nutrition.
Yes.
And that's actually, a lot of my patients ask me, and I'm sure they ask you too, is, well, why can't I just pick something over the counter? Like, why do I have to buy your supplement? I go, well, first off, synthetic supplements at the end of the day are not better than nutrition. Eating a real apple, having a real smoothie, really having that organic fruits, whole fruits and veggies is the best way. But we're all busy.
Yes.
And getting something is better than nothing. So get it from a good source of supplements that are preservative free, that don't have fillers. That is why it's so important, because then you're just wasting your money on over the counter. You don't even know what you're
And
getting.
then you're putting all this stuff in your body that like you don't know what it's going to do to you.
Right.
You don't even know what it is.
Right.
Yes.
And also, I think what patients have to understand, I'm sure you tell them, is that they're made in mass produce,
Yes.
right? Like mass amounts. So they don't care about your health. They just want to sell you a vitamin D supplement. They just want to sell you vitamin A or a multivitamin. And what is it really doing? So it's like overall of everything. So I want to talk a little bit about, like when you see hair loss come and, what are the common causes of hair loss that you see? And why do you feel like so many women, particular, because men, we understand, it happens. I feel men are so much easier sometimes. Right? Sometimes, yeah. It does depend. It does, yes. But when it comes to women's health, like we deal with so many hormones, we deal with so many outside stressors. And so what do you think is the most common cause that women lose their hair? Like what have you seen?
I would say definitely hormonal and stress, 100%. We're seeing a lot of women come in who are in perimenopause, even in menopause, thyroid issues, and stress are the majority of women I see, their adrenal glands are shot.
Thank you for saying that.
Yes.
Thank you for saying that. So adrenals play a role in hair loss,
100%,
ladies.
because your adrenal glands are what produce the cortisol.
Exactly. And want to add to it. So I get a lot of questions about cortisol. So the first thing I get is, oh, well, I don't have any cortisol. I barely have any cortisol. I have no problem. Like, yeah, you have zero. Your adrenals are shot. Like you killed them through years and years of stress and Adderall use. Sorry, guys. Adderall killed your adrenals.
Yeah.
And then they'd say, well, it shouldn't be this high. No, it shouldn't be this high. Shouldn't be this low. Hair loss, right? So the adrenals. So that's the big one you see.
Yes.
Okay.
Yep, adrenals is big. Let's see. Androgenetic alopecia is hormonal.
Right. PCO or PMOS, basically.
Yeah. PCOS and then that male and female pattern loss is hormonal. Because with the enzyme, there's an enzyme called 5-alpha reductase.
Uh-huh.
And that takes testosterone and it converts it into DHT.
Okay.
And that DHT is what miniaturizes your follicles.
Mm-hmm.
Now, everyone's like, oh, well, should I start a DHT blocker?
Mm-hmm.
And I'm always hesitant to put anybody on a blocker,
Okay.
whether they have a blood test or not, because you could have normal DHT levels, but it just depends on how your body reacts to that DHT, how sensitive you are to that DHT.
Okay.
We could have the same DHT level, but I'm more sensitive to it. So now I have androgenetic alopecia.
I see. Wow. So what do you do in those cases? Because that's a very common issue, actually.
So with androgenetic alopecia, it is progressive. There's nothing you can do to stop it. You can you can slow it down, but it will always continue to progress. Now with right nutrition, right supplements, lifestyle changes, working out, things like that, in-center treatments, like we do OneMDHealth, which is a transdermal with peptides, transdermal ultrasound with peptides.
I would love to hear more about that.
Yeah.
Peptides, there's that buzzword, right? Everyone's talking about peptides.
Yeah.
So it's like a transdermal peptide.
We use transdermal ultrasound
Okay.
and air pressure. So the transdermal ultrasound opens up the stratus layer of your skin.
Okay.
It's kind of like bricks, and then it opens up that layer. And then we add the peptide on top. There's no needles, no injections. And then we bump up the power and add air pressure. And then with the ultrasound and the air pressure, it drives that serum in between those cracks directly to your follicles.
Wow.
So it's nourishing the follicles, feeding the hair cells, creating new hair cells, bringing collagen, blood flow. Yeah.
You see me smiling,
I
right?
know.
I'm like so like excited.
Yeah. I get excited too.
I'm like, wow.
This stuff.
This is freaking amazing.
Yeah,
this is
really
what
cool
this
stuff.
is what we need. This is what men and women need. We need to know about these treatments. A lot of times, like I don't even think patients even know or even heard of trichology. Like it's a real science.
Yeah, and I think the default is to go to a dermatologist.
Yes, let's talk about that.
Yeah.
So a lot of my patients go to dermatologists for hair loss because who else can you go to?
Right.
Because they understand the skin and, they're great dermatologists. But really, so what makes a difference between dermatology and trichology?
So I'm a little partial because I am a trichologist, but I find with my experience of the clients who have come from dermatologists that number one, they typically don't even look at your follicles. They'll look at the scalp with their eyeballs and say, oh, yep, this is what it is. Slap a Band-Aid on it, give you some minoxidil and send you on your way.
True.
So
Yeah.
they're not doing any additional testing to see what any underlying causes are. You have nutritional deficiencies. Is your gut microbiome out of whack? Is your scalp microbiome out of whack? So it is just a really quick one and done 20-second look at your scalp, throw some minoxidil on there and send you on your way.
That is basically what all my patients come and tell me. Well, I got minoxidil, Dr. Hashmi. Like, is that okay? And I don't even sure what to say to them. Like, yeah, sure. I mean, what can you say? But let's check out your gut. Let's check out your nutrition. That's really important. So I think that it's fascinating that you can offer the whole spiel because that's what we need to know. And what can they do to reverse the hair loss? So a lot of women, a lot of my patients who are in perimenopause and menopause, is there hope for them?
Yes.
Okay, that's really, okay, there's hope, ladies.
There is
We can
hope,
keep our hair. We can keep our hair. We do not need to. I mean, I could keep going blonde and I don't need to worry about my follicles, right? No, she's just going to say that because she has to.
Yes.
Okay. Okay. All right.
But I will preface that by saying the sooner you come in, the better chance you have of getting the results that you want.
Okay.
Yeah.
When their follicles are still alive?
Yes, correct. So the longer you wait and the thinner your hair gets, the longer it's going to take to get you back to where you were, if that's possible.
Okay.
Right?
Okay.
So the moment you start noticing shedding, that's when you want to make your appointment.
And that's usually like in the perimenopause era.
In the perimenopause area.
What about menopause? Is there still hope they can still have some awake follicles?
Yeah. And everyone is so different. So not everybody's hair is going to thin as much as somebody else's. The really nice thing about what we do as well is if you are at that point where maybe regrowth isn't an option anymore, we have alternative hair options.
Okay.
So either way, you're going to walk out feeling your best self. It just depends on the avenue we take to get there.
So unfortunately, we do have to wrap up in the last 5 minutes. You said two really amazing things that I wanted to discuss. You mentioned the scalp microbiome.
Yeah.
So we know the gut microbiome. We know the vaginal microbiome. Those are ones I know. There's a scalp microbiome?
Your scalp has a microbiome.
Really?
Yes.
Can you elaborate on that a little bit?
So just with the gut and just with the vaginal microbiome, your scalp does have a microbiome.
Interesting.
So when we take a look under the trichoscope on the scalp, sometimes we see kind of like a layer of film on the scalp.
Okay.
And that indicates to me that their scalp microbiome is out of whack. It's mostly due to diet. If you're eating a lot of processed foods,
Okay.
it overproduces sebum or oil in your scalp.
Stress.
Stress, absolutely.
Okay.
Hormones, literally anything and everything, just like your gut and your vaginal microbiome can throw off your scalps, the products that we're using.
Okay.
All the additives and the fillers and all of that stuff, hair
Okay.
products.
Okay. And do you find that, as we age, unfortunately, our scalp's just more vulnerable to it? And that's what shrinks the follicles, basically, is just that additive processed.
Yeah, the DHT and androgenetic alopecia is what physically miniaturizes follicles.
Okay.
But when we have buildup on our scalp, that
Okay.
can clog the follicles, preventing new hair from coming through. So when you have something like a fungal infection on your scalp, it's going to clog those follicles. The follicle can't breathe, and it's literally blocked from new hairs coming up.
Okay.
And then you'll start to prematurely shed. It'll seem like your hair is thinning because new hairs can't come up.
Okay. I see. So I love it. And so the last couple questions I want is what nutrient deficiencies particularly that you see that are common in just generalized hair loss, like zinc, protein, vitamin, like what would you recommend to prevent hair loss as much as possible before coming to see you? And what particular nutrient deficiencies do you really see that are very common in hair loss?
So I'll start with the common deficiencies first. So iron is huge. A lot of, especially women, are low on iron, and that will cause hair loss. This is part of the problem that I see with like the hair regrowth vitamins, right? That they say they regrow your hair.
Yes.
Vitamins are not designed to regrow your hair.
Okay.
They're designed to support healthy hair. So zinc, biotin, all of those vitamins are really good to support healthy hair growth, but they will not regrow hair that has been lost.
I see.
And that's a common misconception that people.
Well, which brings me to my next question. I could talk to her all day again. Also, how do you feel about PRP?
No.
No. Okay. Love it. All right. Tell me.
Okay. So if you think about what PRP is, right? You are extracting your blood, right? You're spinning out the plasma, and then you're injecting that blood back into you. Have you dealt with any underlying issues, any underlying conditions? Have you dealt with your hormonal issues? Have you dealt with your gut issues? If you haven't, you're essentially extracting damaged DNA and putting it back into your scalp.
I see. Exosomes.
Yes.
Okay. Exosomes are a win. All right. Wonderful.
I will say there are studies where exosomes are they have better results than peptides.
Okay.
Quicker results.
Quicker results? Okay.
Quicker results than peptides. Peptides can take a little longer. I just caution on where those exosomes are coming from.
Right.
Yep.
Source matters, ladies and gentlemen.
So that's
yes.
why I err on the side of peptides because they're plant-based.
And you can,
Yeah.
I love my plants too. They're natural. They're natural. But yes, exosome source really does matter. And if you are going to do exosomes, make sure you trust from a medical doctor like myself, because all I would give is proper exosomes. So I love that. So, we'll wrap up with one last question here. If listeners could take away one message about hair health, what would it be?
That's a good one.
Yes.
I would say just know that if your hair is shedding, that is not the problem. Yes, it is an issue, and yes, we want to resolve that, but that's not the original source, right? So if your hair is shedding, if your scalp is itchy, if you have psoriasis, eczema on your scalp, there's always an underlying issue going on. So hair loss is always a symptom of something going on internal. When our bodies are in chaos. Our internal body is in chaos. What happens with the sympathetic nervous system is it actually starts to shut down organs it deems unnecessary for survival, which includes our gut, which includes our skin, our hair, our nails, right? So when our body starts to shut down, the hair, skin, nails, gut, whatever it is, that's your first clue that something's going on. It needs to be addressed.
I love that. I love everything you're saying. It's just things that I have been really preaching, and I want to add to it is that, yes, the sympathetic nervous system and the parasympathetic play a huge role in everything in overall health, gut health, hair, scalp health, vaginal health, weight loss, all of it. And I love this conversation because it reminds us that our bodies are always communicating with us. Hair changes aren't just cosmetic. They can be clues to our overall health and wellness. Thank you so much for joining us today, Brittany. You have been such a pleasure, and I cannot wait to have you again on the show. And because I'm going to be your client, and then we'll talk about my results, what it shows. Yes. Yeah. Thank you again for joining us here at OneMD Health. Until next time. All right. Thank you. Yay. Thank you for visiting OneMD Health Podcast. Please like and subscribe if this podcast resonates with you. If you have any questions, please visit my website, SamiyaHashmiMD.com.